There's a number I want you to sit with for a second. $127,750. That's not a house. That's not a college fund. That's the median cost of 1 year, one single year, in a private room in a nursing home in this country right now. And here's the part that should make the back of your neck go cold. Medicare does not pay for it. Not most of it. Not the part that matters most. You spent 40 years believing that when the time came, Medicare would catch you. And for a hospital stay, it will. But for the thing that actually drains seniors dry, the long, slow, expensive kind of care, there's a gap. A hole in the middle of the safety net. And almost nobody is standing close enough to see it until they've already fallen through. I've watched it happen. I've watched a couple who did everything right, saved, invested, paid off the house, lose $200,000, $300,000 for $100,000 in the span of 3 years. Not to a market crash, not to a bad stock tip, to a gap they didn't know existed. Because here's what nobody's telling you. A market crash is loud. It's on the news. People warn you about it for years. This gap is silent. It costs more than any crash you'll ever live through, and it sends you no warning at all. So in the next 15 minutes, I'm going to show you exactly what this gap is, why it costs more than a market crash, the 4 protections that close it, and what you can do this week. Calmly, no panic, to make sure it never swallows your nest egg or your independence. There's a window here, and it's narrowing. I'll show you why it's narrowing on you specifically, and why the time to act is before 2027, not after. Stay with me. This is the one most people get wrong. Let me tell you who I am, because you should never take advice like this from a stranger without knowing where it comes from. I'm Dr. Ellen Hart. I've spent more than 30 years working with older adults and their families, in the exam room, at the bedside, and across the kitchen table afterward when the bills started arriving. I've sat with thousands of patients, and I'll tell you the truth. The medicine was rarely the hard part. The hard part was watching good people get blindsided by a financial trap nobody had ever explained to them. The doctor talks about your heart. The banker talks about your returns. Almost no one connects the two. And the place where health and money collide is exactly where families get hurt. Now, I have to say this clearly, and I mean it. This video is education, not personalized medical or financial advice. I'm not your doctor, and I'm not your financial advisor. Nothing here tells you to change a medication, stop a treatment, or buy a specific product. What I'm giving you is the map. The decisions are yours, and you should make them with your own physician and a licensed financial professional who knows your full situation. Think of this channel as a wake-up call, the friend who taps you on the shoulder before the door closes, not a substitute for the people who'll sign their name next to your plan. If that's the kind of straight talk you want more of, the subscribe button is right there. But let's get to the thing that matters. Here's the mechanism. I want you to stop thinking about this as bad luck, because it isn't. It's a machine. It runs the same way every time, and once you see it run, you can never unsee it. It starts with a single health event. A fall, a stroke, a diagnosis with a long name. Medicare steps in for the acute part, the ambulance, the hospital, the surgery. So far, so good. Then comes rehab, and Medicare covers a stretch of skilled nursing care after a qualifying hospital stay, but only up to a hard limit, and only while you're actively improving. The moment the care you need stops being skilled and starts being custodial, help bathing, help dressing, help eating, help simply getting through the day, Medicare steps back. That's not a loophole. That's the design. Original Medicare was never built to pay for long-term custodial care. And custodial care is precisely the kind most of us will need for the longest time at the highest cost. So the bill lands on you. And watch what it does. That bill doesn't sit politely in a corner. It reaches into your retirement accounts and starts pulling. To cover $10,000 a month, you sell investments, often at the worst possible time, often triggering taxes, often in a down market, because crises don't wait for the market to be friendly. The healthy spouse, the one still at home, suddenly has less income and the same expenses, so they cut back, they dip in, they borrow. And here's the cruelest turn of the machine. Somewhere in all of this, the person making the money decisions may be the same person whose health is failing. Cognitive decline doesn't announce itself. It quietly erodes judgment right when judgment matters most. And good people make rushed, fearful, irreversible choices with a lifetime of savings. A health event triggers a cost. The cost forces a bad financial move. The bad move compounds. That's the wealth spiral. And the reason it beats any market crash is simple. A crash takes paper. Historically, markets have fallen and, given enough time, recovered. This money doesn't come back. You don't get a rebound on 3 years of nursing home bills. It's spent, and it's gone, and the spiral keeps turning. It's that simple. It's that brutal. Let me make it a person, because numbers slide off and people stick. I want you to meet Margaret. Margaret is 68. I'll tell you up front. Margaret is a composite. She's stitched together from many families I've known, so no one's privacy is on the table. But every piece of her story is real because I've watched every piece happen. Margaret and her husband Jim did it right. Paid off the house in Ohio, bought a small condo in Florida for the winters, saved up a little over $500,000. They had a trip to Italy circled on the calendar. Margaret felt great at 65. Strong. Healthy. So when the paperwork came across her desk about supplemental coverage and long-term care, she did what most healthy people do. She thought, I'll deal with that later. I feel fine. She put it in a drawer. Then, at 67, Margaret had a stroke. Medicare was there for the hospital. Medicare was there for the rehab for a while. And then the calendar ran out on what Medicare would cover, and Margaret still needed daily help, every day, the kind that doesn't end in a month. The facility cost over $10,000 a month. Do that arithmetic with me, out loud, because the arithmetic is the whole story. $10,000 a month is $120,000 a year. 3 years of care, and 3 years is not unusual, is well over $300,000. More than half of everything she and Jim had spent a lifetime building, gone, to a gap she'd put in a drawer. And here's the part that still makes me ache. When the family tried to go back and get Margaret the supplemental coverage that could have softened the blow, the Medigap policy she'd skipped at 65, they were told no. Because by then she had a pre-existing condition, and the easy door had already closed behind her. The window to get that coverage without anyone judging her health had quietly shut 2 years earlier, while she felt fine while it sat in the drawer. She didn't lose that protection because she got sick. She lost it because she waited. Don't be Margaret. Not because Margaret was foolish. She wasn't. She was the most responsible person on her street, but because Margaret didn't know the machine was running. Now you do. So let's close the gap. For protections, come and doable. The first protection is this: know exactly, in writing, what Medicare does not cover before you need it. This is the protection that costs you nothing but an afternoon, and it's the one that saves you from every nasty surprise downstream. The health angle is that the care you're most likely to need as you age, the long, custodial, day-to-day kind, is the care original Medicare was never designed to pay for. The money angle is that families budget their entire retirement around a coverage they don't actually have. They assume the net is under them, so they never build their own. The precedent here isn't a study I'm inventing for you on the spot. It's the plain, published design of the program. The same thing every elder law attorney and every honest advisor will confirm. Medicare covers acute and skilled care with limits. It does not cover ongoing long-term custodial care. So here's exactly how to act on it this week. Pull up your Medicare summary or call the number on your card and ask one blunt question. What happens if I need daily help for a year or more? Listen to the answer. Then go look up the real cost of care in your own state. The median nursing home and assisted living and in-home figures are published every year, and they're free to look at. Write your state's number on a piece of paper and tape it to the fridge. Right now, before you forget, open your insurance summary and find the word skilled nursing. Notice it doesn't say for as long as you need it. That gap, in black and white, is the whole reason you're watching. The second protection is the one that closed on Margaret, and it has a clock on it, so listen closely. It's this: lock in your supplemental coverage during the one window where they can't say no. When you first turn 65 and enroll in Medicare Part B, federal law gives you a one-time 6-month window, and during those 6 months, an insurance company selling a Medicare supplement, a Medigap policy, cannot turn you down, cannot charge you more, and cannot hold your health history against you. That's called a guaranteed issue right, and it is one of the most valuable things you will ever be handed and never told about. The health angle is obvious. Your health can change in a single afternoon, and after that window, in most states, the insurer gets to look at your medical history and decide. The money angle is enormous because Medigap is what catches the deductibles and the coinsurance that original Medicare leaves on you, costs that have no annual cap on their own. Here's the precedent, and it's not in dispute. This 6-month rule is written into federal law, and after it ends, the protection against medical underwriting generally ends with it. Wait, and you may pay far more or be declined outright. Exactly what happened to Margaret. So how do you act on it? If you're inside that 6-month window right now, this is not a later task. It's a this-week task. The supplement plans are standardized, meaning a Plan G is a Plan G no matter who sells it, so you can compare honestly on price and reputation. Call your state health insurance assistance program. Every state has one. The counseling is free and unbiased, or sit down with a licensed agent and compare. And if you think you already missed your window, don't assume the door is bolted. Some states and some carriers are more flexible than you'd guess, and there are special situations that reopen guaranteed rights. Ask. The worst answer is no, and you're no worse off in the silence you have now. The third protection is where most people freeze, so I'm going to make it simple. It's this: build a dedicated plan for long-term care costs, kept separate from your everyday nest egg. Not a vague hope. A plan. The health angle is that nearly all of us will need some long-term help at some point. That's not fear-mongering. That's the actuarial reality of living longer. The money angle is that if you fund that care straight out of your retirement accounts, you don't just spend the money, you trigger the whole spiral I showed you. So you give it its own bucket. Now, there are several honest ways to build that bucket, and I'm not here to sell you any single one of them. I'm here to make sure you know they exist. There's traditional long-term care insurance. There are hybrid policies that combine life insurance or an annuity with a long-term care benefit. There's deliberately earmarking a slice of your own savings and never touching it for anything else. And for some families, there's careful, legal Medicaid planning done well in advance with an elder law attorney. Each is trade-offs. Each fits a different person. The one thing they all share is this: they get more expensive and harder to qualify for the longer you wait, because pricing depends on your age and your health, and both of those move in one direction. The precedent here is just the published cost trend. The cost of care has been climbing faster than ordinary inflation year after year, which means every year you delay, the bucket you need to fill gets bigger. So act on it this way. Don't buy anything this week. Just make one appointment. Sit down with a licensed financial professional, lay out your numbers, and ask them one question: which of these approaches actually fits my situation, and what does it cost me to start now versus 5 years from now? Let them show you the math. Then you decide, on your timeline, with your eyes open. The fourth protection is the one people skip because it isn't about money on the surface, but it protects your money more than almost anything else. It's this: put your decisions in writing and name your people while you're still the one holding the pen. The health angle is the hard truth I mentioned earlier. A health crisis, and especially cognitive decline, can take away your ability to manage your own affairs right when those affairs get complicated. The money angle is that if no one has the legal authority to act for you, families end up in court, paying lawyers, fighting each other, sometimes for guardianship, while the bills pile up and the bank account sits frozen and untouchable. The precedent is every family that ever had to learn this the expensive way, and there are more of them than you'd ever believe. So here's exactly how to act, and you can start this week. You need a durable financial power of attorney, someone you trust, named in a legal document, who can pay bills and manage accounts if you can't. You need a healthcare proxy and an advance directive, someone who can speak for your medical wishes and a written record of what those wishes are. And you need a simple, current list of your accounts and policies, kept somewhere your trusted person can find it. Make one call to an attorney to get the documents done right. And right now, before this video ends, decide in your head who that trusted person is. Just pick the name. Naming them is the first protection of all. Now let me turn those four into something you can actually walk through, because a list you don't sequence is a list you don't finish. Here's the plan. This week, just this week, you do the free things. You find the words skilled nursing in your coverage and you read what they really say. You write your state's cost of care number on the fridge, and you find out the exact date your Medigap window opened or opens, because that one date governs everything in Protection 2. That's the whole assignment for week 1. Nothing bought, nothing signed, just truth on paper. Then, over the next month, you make appointments, not decisions, appointments. One with your state health insurance assistance program or a licensed agent about supplemental coverage. One with a licensed financial professional about the long-term care bucket. One with an attorney about the documents. Spread them out. One a week. By the end of the month, you've talked to the 3 people who can actually close this gap, and you've spent almost nothing to do it. And in the months after that, you simply act on what they told you, in the order that's most urgent for you. And if you're inside a closing window, that one jumps to the front of the line. That's it. Gradual. Low stress. Written down. Because the entire point of building a system now is so that emotion isn't the one making the calls later in a hospital hallway at 2 in the morning when fear is loud and judgment is thin. Write it down now. And the calm version of you protects the frightened version of you from making a $300,000 mistake. Now, I know the voice in your head. I've heard it from the smartest, most capable people I've ever met. It's saying, maybe I should wait until I'm a little older. Or, my doctor never mentioned any of this. Or, my advisor would have told me. Let me speak to that voice honestly, because it deserves an honest answer. Your doctor didn't mention it because your doctor is trained to manage your blood pressure, not your balance sheet. That's not a failing, it's just a different job, and the gap between those 2 jobs is exactly where families fall. Your advisor may not have raised it because long-term care planning sits in an awkward corner between medicine, insurance, and law, and a lot of people simply route around it. Here's what they don't tell you at the doctor's office or the bank. The system isn't built to walk you to this door. You have to walk yourself. And wait until I'm older is the single most expensive sentence in this entire subject, because waiting is precisely what closes the windows and raises the price and hand your health history to an underwriter. Most people watching this will nod along, feel that flicker of recognition, agree it's important, and then do nothing. Life gets busy. The drawer is right there. And in 2 years, they're Margaret. Don't be most people. Most people are the ones the machine is built to catch. So here's where the window comes back, and why I keep saying before 2027 and not someday. This gap doesn't get cheaper while you wait. The cost of care climbs every single year, faster than ordinary inflation. So every year you delay, the number on your fridge gets bigger. Your enrollment windows don't reopen on their own. Once that guaranteed issue period passes, it's gone, and your health gets the final word. And your own health is the one variable none of us can schedule. Every month between now and 2027 that you stay unprotected is a month you're gambling that nothing changes. And the whole reason this gap costs more than a market crash is that, unlike the market, it does not come back. There is no rebound on care you've already paid for out of pocket. So this isn't a someday decision. It's a now decision, and the line is simple and a little merciless. The people who act in the next stretch of time protect their health, their savings, and their independence. The people who hesitate spend the next decade paying for the gap they didn't close. One group will thank themselves. The other will wish they had. So here's what I want you to do. Turn off this video. Right now, go find the exact date your Medigap window opened. That one piece of paper governs Protection 2, and it has a clock on it. Just that. One date. Start there. Start today. Because in 6 months, you will either be the person who calmly closed this gap while everything was quiet, or the person staring at a bill and wishing they'd spent one afternoon when they had the chance. And before you go, do one more thing for the person watching this after you. Write your biggest worry about this in the comments. Your number, your situation, the thing that scared you most in the last 15 minutes. Saying it out loud is how it stops sitting in a drawer and starts becoming a plan. If this opened your eyes even a little, give it a like so it reaches the next person who needs the tap on the shoulder, and subscribe because the next gap they're not warning you about is the one I'm covering next. Don't be Margaret. Don't be most people. Close the gap. I'll see you in the next one.